Including AIDS. We cannot cure most chronic degenerative diseases. We can replace hips, we can replace joints, we can replace the knee, but we cannot really cure that. We just replace the hip, okay, or the knee. We cannot cure most forms of allergy or autoimmune diseases. We cannot effectively manage most psychosomatic illnesses and most forms of cancer, except maybe skin cancer. We don't have the answers to all of that. So this is probably where I would be personally lenient in having those patients maybe try complementary approaches. The problem being, is there enough evidence that it works or not? Now, with complementary approaches, it may be useful, it may have no effect, but it can also be harmful. And you're talking about the economic consequences in terms of trying out a modality or a therapy which may have no effect, but may also be harmful. There are some herbs, and you have it in your Harrison's Principles of Internal Medicine, which are known to be harmful as well. Some hepatotoxic and nephrotoxic herbs, and some herbs which interact with other drugs that we give our patients. So you have to be aware of that. However, there are lots of things that we can do very well as physicians. If you have trauma, you have a fracture, you cannot just meditate that away. Okay? If you get an appendectomy, you cannot just do qigong or just do visualization, mawala yung appendicitis ko, it doesn't work. Okay? So if you have a pneumonia, and it's a bad pneumonia, hindi yung debate nila ni Alfred sa Cebu na mild pneumonia, but it's severe pneumonia, you need antibiotics for that to get well. Parasites and fungal infections, you need to treat that. Now, immunization, very important. If it weren't for immunization, some of us may not have been here right now. Our parents may have died because of some illnesses. We may not have been born. You may not have been here right now listening to me talk. I would have enjoyed the pleasure of your company as well. Okay? Diagnose complex medical problems. How's ND, diba? Complex medical problems. Replace damaged knees and the hips. Cosmetic reconstructive surgery. We cannot do that with complementary medicine or alternative. And hormonal abnormalities. Hypothyroidism, hindi pwede. Or if you have a patient with an estrogen deficiency, kulang siguro ang tofu, though tofu has phytoestrogens. But hormones will be very important. Okay? Now again, you know this, we won't go through this. Whenever you employ any treatment modality, as I said, you have to make sure that it's evidence-based. Yun lang naman. Okay? So again, the least form of evidence, alam nyo man anecdote, diba? Anecdote, right? Sabi ng kapitbahay, okay, ito inumin mo rin ba? Next level of evidence is the case report, and then you have a case series, and then you have a randomized clinical trial. That would be the best level of evidence, no? And it's placebo-controlled, double-blind, multinational, triple-blind, and then that would be the best source of evidence. Okay? Now, there's some more interesting points in time. Parating lumalabas yung dots na yan. I can't figure that out. But anyway, there are certain things which are alternative before, but conventional now. So we have to be open to these complementary approaches. Because remember, in the integral scheme of things, there seems to be a role somehow, but we don't see it yet. Or maybe it's not that evidence-based yet. No? Before, radiation was just an alternative form of therapy. TENS was an alternative form of therapy, electrical therapy natin. The use of gilding or leeches, no? They use that now in medicine for blood clotting as well, no? As for the brigma. Okay? And also remember chondroitin sulfate, no? For your sharp cartilage, for osteoarthritis, they use that also now. Okay? Now we have to remember that we are healthcare and not health cure givers. No? Okay? The reason why a lot of these thumb practitioners actually are making very well, I think it's doing well, it's because of the care that they give to their patients. The time spent with their patients. They listen to their patients. No? How much time do you spend with your patients in the usual clinic consult? If you get into complementary alternative medicine, it takes about an hour for the initial interview. Anong beliefs nila, anong religion nila, what do they think about their illness, how many family members are there, things we sometimes take for granted. Malala ko when I was a resident and I had a patient who came in, and this patient was given by an albulario, was given a oral hypoglycemia. So comatose. We should be all knowing and not commit mistakes. Ang office ni Bernie Siegel sa labas may nakalagay doon, beware, the doctor commits mistakes. Okay? Siyempre, tao naman. Now, I was lucky to attend the workshop with Rachel. Now, si Rachel, she has this workshop every year, so we're interested in attend that. The workshop is CME workshop on reclaiming awe, the sense of mystery, newness, the sense of awe and medicine. Okay? That's her first signing one of her books. One of her books is Fiction Taking Wisdom, another book is My Grandfather's Lessons. Ito, I got this from some of her talks during the workshop. Sabi niya, as physicians, most of us lead far more meaningful lives than we realize. We're often in the humdrum of what we do every day, nakakalimutan natin minsan na mahalaga yung ginagawa natin. Okay? We're often distracted by time pressure that we don't have a sense of meaning. No? Now, meaning is an antecedent to commitment and it's actually a doorway to spiritual practice. So whatever you do is actually a spiritual practice if you put it in that perspective. No? It strengthens us not by changing only our lives, but by transforming the experience of our lives. Okay? Now, some people can Rachel said before, Rachel, that's fine, we're attending this workshop. What do I do when I go back home? Nandito, I can remember to be by medicine. Paano pag ko sa bahay when I get into the pressures, ICU, intubated patients, mechanical ventilators, calling me up at night to resuscitate patients, intubate them, give lectures, talk to you. That's very pleasant. So actually, that's my okay, what do we do when we're back there home? Sabi niya, one thing that she advises them, before going to sleep at night, for each of us, we need to review, think pedagogy of reflection, which is not going to talk about. Review the day, going backwards from where you are right now. So malapit po ka naman to look back before you lie down. Sit down and review the day going backwards. Find out what surprised you. Whatever surprised you. It hasn't have to be anything grand, no? Okay? What inspired me today? So you have to sit on it. And what touched my heart? The importance about doing that is if you do that frequently, when that experience meets you in the clinic, this is a surprising moment. Mag-connect na tayo. This is an inspiring moment. This is a moment which is touching my heart. Okay? So, otherwise, may biro nga, diba? You want to make an Englishman happy, kaya yung joke mo niya. Makuha na, kung pa yung nakuha ang biro. No, if you don't want to be in that rock, then it's important, I think, we should try this and see if it works. Alright. You sit on it. Okay? Surprised and inspired by that. Now, sabi nga ni Rachel, things can be considered a Western form of meditation. When you get sick, why did I get sick? What's my purpose for getting sick? What can I learn from this? How can I contribute to society because of my illness? No? Marami, it's multifaceted actually. It's beautiful. Now, another thing is, that was from Rachel and what you can do with the civic experience. This is John Tabasa. Si John Tabasa